Hi, I'm Dr. Terry. I'm back to give you some more information on how you can get healthier and, more importantly, get to the cause of your problem. Enough of dealing with these symptoms. You know, it's great. You go to the dentist and you got TMJ. That was our last YouTube that we did. I advise you to go check that out if you know anybody who's got TMJ, jaw joint problems, that is. And they give you this little football mouth guard for $500 to $1,000. That's great. It may temporarily help with the symptoms, may, underline may, right? But why do I have it? What's the deal, right? Okay? Same thing with our topic today, which is small intestinal bacterial overgrowth. Let's make that a little bit better. There we go. Small intestinal bacterial overgrowth, better known as SIBO. So SIBO is really difficult in a lot of cases to get rid of. And I want to tell you why. Because there's a huge, huge piece that's getting cut out. Again, the cause. One of the major causes. Now, SIBO traditionally is multifactorial. What do I mean? A lot of different little causes coming together to create a major issue. SIBO gives you that pain down here. It's also used to be called irritable bowel syndrome, IBS, right? So you get stomach aches, you get bloating, you get gassy, all those kinds of things. And yes, it has to do with the gut microbiome. And when we get things like, when we're eating foods like gluten, dairy, sugar, or even some nightshades. I'm abbreviating here, nightshades, right? Even nightshades, eggplant, peppers, tomatoes, for some people, not for all of us, okay? But these three for sure are going to cause what we call leaky gut. And that leaky gut actually is where the intestinal cells start to separate. Remember, this is incredible how God did this. The intestinal lining is one cell thick. That's what separates the food in this tube that we call the intestine from your bloodstream. One cell. Crazy. And they're held very tightly together by a rubber band type muscle, no quiz, big word, big Scrabble word, called endomysium, okay? A lot to do with vitamin D in that endomysium. That's why it's important to take vitamin D every day. But when you look at this, think about these foods over time will cause inflammation in the gut lining and start to separate out those cells. The cells will start to open up, and then food in big chunks can now get right into your bloodstream, and that creates a whole issue and messes up your gut microflora, the bacteria, right, in your gut, and now you're off to the races, so to speak, right, as you're excusing yourself and racing to the restroom perhaps. But there's a piece that's missing. A lot of people get frustrated because they take probiotics, they take prebiotics, they take their vitamin D, they take their vitamin K, they do all these different things. They're taking multiple types of probiotics, as the case may be. They're doing their bone broth, they're doing their collagen, etc., etc. Those are wonderful things to do. I applaud you for that. But watch this. If I cut the nerve supply off, if I tied this rubber band around a nerve that was going from your neck down your arm or your low back down your leg, over time, what would happen to that muscle in your arm or the muscle in your leg? Exactly, they get flabby, right? They start to get weak. That's what happens to our small intestine. The main nerve supply of our small intestine is the vagus nerve, which is right, can you see that, vagus nerve? Right above our first cervical vertebra, in that area where people get those headaches, right? They call them stress headaches. No, it's a misalignment of that first cervical vertebra, also known as the atlas. This is huge because just like a machine, if it's not plugged in, it can't work. If it has no power source, it can't work. If your intestines, which are in essence cells, but of course they're a machine, right? Those cells are like a machine. They need a power source, and that power is delivered by these wires that we call nerves. In this case, the vagus nerve. So let's take a look at this x-ray for a minute. So we have this x-ray up here. Here's the jaw. Here's the skull. So this would be the throat and the back of the neck. Good, you oriented? So we're looking at this picture right here. Okay? So in this young lady's case, she has lost that curvature in her neck. So what does that have to do with SIBO? A lot. And perhaps everything. Watch. So the blue line represents two things. One, the position of the back of the vertebra. Number two, it represents, remember, inside these bones, inside the bones is what? Our spinal cord, right? So here's the vertebra, right here. And right behind the vertebra, I marked in blue and blue. Boom, there's your spinal cord. So when we lose this curvature, our spinal cord goes from relaxed. It gets pulled really tight and taut. And as it's doing that, it's getting irritated. It's firing off, telling all the muscles in our neck and upper back to do what? Contract, to guard and protect. To not let the bones go further out of place. But at the same time, it's pulling on the brain. Because the spinal cord is really a tail. That's right, you heard me right, a tail of the brain. So as you pull on the spinal cord, do your forward head posture, you then pull on your brain, and often you pull on the vagus nerve, which is approximately right above that first cervical vertebra. The vagus nerve then can't function properly, it gets compromised, and it can't, the vagus nerve starts way up here, travels all the way down the spinal cord, and controls everything to do with our digestive tract, except for our very, very distal colon, okay? So when that happens, vagus nerve supply, the power, can't get to the cells, and the cells can't function the way they're supposed to. Microbiome can't function the way it's supposed to. So we're taking all these supplements, again, great, awesome, expensive, but great and awesome, right? But do we have to be taking these for the rest of our life? Well, check out your posture. So for a complimentary computerized postural analysis and 3 free tips on how to improve your posture, go to the link below. Check it out. It's absolutely free. No strings attached. And off of those, you can start immediately doing things to correct that posture and bring your head back and start to fix that vagus nerve, okay? So click the link below. Give us a call if you'd like. God bless you. Stay tuned for our next topic.